valgus and varus stress test. So your medial collateral ligament has a superficial and a deep band, and they tense differently in extension or flexion. So you're going to do the valgus test at full extension and at 20 degrees of flexion. Now when you do it at full extension, you're getting the superficial fibers of the MCL, but you're also kind of getting a general sense of the rest of the structures in the area, the capsule, and even the integrity of the medial tendons. So you're going to hang on to the leg. You're going to hug the leg, put it close to your body, and then you're going to place your hand on the medial aspect of the tibia. Okay? Your other hand is going to go on the lateral aspect of the femur. We bring into full extension. So if you bend the knee, you can find the joint line, so you can stay decently close to the joint line, but you are on the condyles. You're not directly on the joint line. You bring it into full extension. So now what we're going to do is one hand stabilizes, one hand moves. So the right hand is going to do a force to stabilize on the femur, and the left hand is going to induce the valgus stress. But we're doing it through body movement. So again, you're working on that motor planning to be able to stabilize one hand and move the other. Okay? So we come here, full extension, stabilize, and then I pull out. Okay, and I'm waiting the 10 seconds. The reason for the 10 seconds is it this one or the other one?
They both.
They're both, they will like the other. The reason for waiting the 10 seconds with any stress test is you're waiting to get past some of the muscular tone that's present. We all have resting tone. You're also getting past the viscoelasticity of the ligaments. So kind of getting into the creep level of the ligaments. Whoa. You okay? And then once you get past the viscoelasticity, you're starting to really get a sense of the laxity or firmness of the ligament. Okay? So you do it at full extension, and then you do 20 degrees of bend. Same technique. Okay? Stabilize at the femur, rotate the body, and start to induce that valgus stress. Hold for that 10 seconds, and feel for the laxity. You're also listening for pain. Okay, because if you get past the guarding and the ligament is a pain generator, when you tense the ligament, it will be painful. Okay? For your varus stress test, you need to go the other way. So it is preferable to go inside the leg. So in general, you never want to be inside the leg, like with your abduction selective tissue tension test. But to get an effective varus stress, you really are going to need to go in the inside. So I'm going to do a force where I bring your knee in like this just to test the ligaments on the outside. Is that okay? Mm-hmm. So I come here, I place my body. So notice how I position my body. I'm immediately turned away, right? You don't want to enter and be standing there like this, right? So there are ways that you can make this not so imposing on your patient. So you come in, I'm immediately turned away. I come in, I hug the leg, place the hand on the inside. Now going to 20 degrees of bend, I'm going to do the stability here, and then I'm going to induce I'm going to do a varus pressure by rotating the body and bringing her in and waiting for the 10 seconds and feeling for the end feel there. We're not going to go to full range. Okay, so that's your valgus and varus stress test. Test the medial structures at full extension and 20 degrees of bend. Test the LCL simply at 20 degrees of bend.
Do you want to show the LCL that way? That way everyone can see it.
You can see that okay? You want to see the LCL on the other leg?
On the other leg.
On the leg? Okay.
No, 0 and 20 is for MCL.
Correct. For the valgus stress test.